Hey everyone, and welcome back to the channel. Today we're diving into one of the most requested topics, prenatal breathing techniques and complete labor preparation. Whether you're a first-time parent or this is your second or third baby, having the right breathing techniques can make an incredible difference during labor and delivery. In this video, we're covering everything you need to know: the science behind breathing during labor, 5 essential breathing techniques you can practice right now, what to actually expect during each stage of labor, and practical tips that healthcare professionals wish every expecting parent knew. So grab a comfortable seat, maybe a pillow, and let's get started. And if you find this helpful, please hit that subscribe button and the notification bell so you don't miss our upcoming videos on postpartum recovery and newborn care. Why breathing matters. Let's start with the why. You've probably heard people talk about breathing during labor, but why is it so important? It's not just about staying calm, though that's definitely part of it. During labor, your body is doing some of the most intense physical work it will ever do. Your uterine muscles are contracting powerfully and repeatedly, and this requires a tremendous amount of oxygen. When we breathe effectively, we're doing 3 crucial things. First, we're delivering oxygen to those hard-working uterine muscles and to your baby. Proper oxygenation helps your muscles work more efficiently and helps your baby stay comfortable during the process. Second, controlled breathing activates your parasympathetic nervous system. This is your body's relaxation response, which helps counter the stress response that pain can trigger. When you're in that relaxation mode, your body releases endorphins, which are your natural pain relievers. Third, focused breathing gives your mind something to concentrate on during contractions. Instead of tensing up against the pain, which actually makes contractions more painful and less effective, breathing techniques help you work with your body rather than against it. Research has shown that women who practice breathing techniques before labor report feeling more in control during delivery, experience less anxiety, and often require less medical pain intervention. That's pretty powerful. 5 essential breathing techniques. Now let's learn 5 breathing techniques that you can start practicing today. I recommend practicing these for just 5 to 10 minutes daily during your 3rd trimester. The more familiar these patterns become, the more naturally they'll come to you during labor. Technique 1. Slow breathing. Early labor. This is your foundation technique for early labor when contractions are milder and further apart. Here's how it works. Take a deep, cleansing breath in through your nose for a count of 4. Hold it gently for 1 count, then slowly release through your mouth for a count of 6 to 8. The exhale should be longer than the inhale. This extended exhale is what activates that relaxation response we talked about. As you breathe out, consciously relax your shoulders, your jaw, and your hands. Tension likes to hide in these places. Between contractions, breathe normally and rest. Let's try it together right now. Breathe in for 4. 1, 2, 3, 4, hold, and out for 8. 1, 2, 3, 4, 5, 6, 7, 8. Beautiful. How do you feel? Even just 1 breath like that can shift your entire nervous system. Technique 2. Light accelerated breathing. Active labor. As labor progresses and contractions become stronger and closer together, you'll naturally want to breathe more quickly. This technique matches that instinct while keeping you in control. When a contraction begins, start with a cleansing breath, then shift to shallow, light breaths in and out through your mouth. Think hee-hee-hoo, or just a gentle panting rhythm. The key is to keep it light and not hyperventilate. You're breathing from your upper chest, not deep belly breaths. As the contraction peaks, you might naturally speed up slightly, and that's fine. As it subsides, gradually slow back down and finish with another deep cleansing breath. This technique helps you ride the wave of the contraction rather than fighting against it. Technique 4. Variable breathing. Transition phase. Transition is the most intense phase of labor, typically when you're dilating from 7 to 10 centimeters. Contractions are very strong and very close together. This is when variable breathing becomes your best friend. Combine different patterns. Try 3 quick breaths followed by 1 long exhale, or use a pattern like he, or just a gentle panting rhythm. The key is to keep it light and not hyperventilate. You're breathing from your upper chest, not deep belly breaths. As the contraction peaks, you might naturally speed up slightly, and that's fine. As it subsides, gradually slow back down and finish with another deep cleansing breath. This technique helps you ride the wave of the contraction rather than fighting against it. Technique 4, pushing breath, second stage. When it's time to push, your breathing changes completely. This is directed, powerful breathing that works with your body's natural urge to bear down. Take a deep breath in, tuck your chin slightly, and as you push, either hold that breath for a count of 5 to 6 while bearing down, or release the breath slowly with a grunt or groan while pushing. Most modern birthing classes recommend the exhale method because it keeps oxygen flowing to your baby, but listen to your body and your healthcare team. Between pushes, take several recovery breaths. Your body needs to reset. Don't be afraid to be vocal. Making low-pitched sounds during pushing actually helps open your pelvic floor.
Technique 5, recovery breathing throughout labor. This is simple but so important. Between contractions, return to normal, restful breathing. Close your eyes if that helps. Visualize your body opening, your baby descending, your strength building. These rest periods are when you gather energy for the next contraction. Don't waste them being anxious about what's coming. Be right here, right now, breathing normally and resting. What to expect during labor. Now let's talk about what labor actually looks like so you can know when to use each breathing technique. Early labor, the beginning. Early labor can last anywhere from hours to sometimes a day or more, especially for first-time parents. Contractions start out irregular and relatively mild. They might feel like strong menstrual cramps or lower back pain. You'll know you're in early labor when contractions start following a pattern, even if they're still far apart. This is the time to stay home, stay comfortable, and use your slow breathing technique. Walk around, take a warm shower, eat light snacks, and rest when you can. Many people find that staying upright and mobile helps labor progress. Use this time to practice your breathing and conserve your energy. You'll want to head to your birthing location when contractions are about 5 minutes apart, lasting about 1 minute each, and this pattern has continued for at least an hour. This is called the 5-1-1 rule, though your healthcare provider might give you different guidance based on your specific situation. Active labor. The work intensifies. Active labor is when things get serious. You're dilating from about 6 to 8 centimeters, and contractions are stronger, longer, and coming every 3 to 5 minutes. This usually lasts several hours. This is when you'll switch to light accelerated breathing or start experimenting with what works for you. You might find certain positions help: hands and knees, sitting on a birthing ball, standing and swaying, or leaning on your partner. Movement between contractions can help baby descend and rotate into the best position. Your support person becomes crucial here. They can apply counterpressure to your lower back, offer water and ice chips, help you change positions, and breathe with you. Don't be afraid to ask for exactly what you need, whether that's silence, encouragement, or a cool cloth on your forehead. Transition, the peak. Transition is intense but typically the shortest phase, usually lasting 30 minutes to 2 hours. Contractions are very strong, lasting 60 to 90 seconds and coming every 2 to 3 minutes. You might feel shaky, nauseous, or like you absolutely cannot do this anymore. Here's what healthcare professionals want you to know. When you feel like you can't do it anymore, that's actually a sign that you're almost done with labor. Your body is working exactly as it should. This is when variable breathing and vocal sounds can really help. You might feel rectal pressure or the urge to push. Tell your care team immediately so they can check your dilation. Don't start pushing until you're fully dilated and given the go-ahead. Pushing and delivery, meeting your baby. The second stage of labor, pushing, can last anywhere from a few minutes to several hours. First-time parents typically push longer than those who've given birth before. You'll feel strong pressure and an intense urge to bear down with each contraction. Use your pushing breath technique and listen to your care team's guidance. They can see what you can't and will help direct your efforts. Between pushes, breathe and rest completely. You're in the home stretch. When baby's head crowns, you might feel a burning or stretching sensation called the ring of fire. Your provider might ask you to stop pushing and just breathe to allow your tissues to stretch gradually. This helps prevent tearing. And then, after all that work, your baby is here. That first cry, that first moment of skin-to-skin contact, it's absolutely incredible.
Practical preparation tips. Let's talk about practical things you can do right now to prepare. Practice makes progress. Set aside 10 minutes each day to practice your breathing techniques. Have your partner or support person practice with you. They should learn the techniques too so they can breathe with you during labor and help you stay focused. Create a birth preferences plan. Think about what's important to you. Do you want immediate skin-to-skin contact? Are you open to pain medication or hoping for an unmedicated birth? Do you want delayed cord clamping? Write these preferences down and discuss them with your healthcare provider. But also stay flexible. Birth rarely goes exactly according to plan, and that's okay. Prepare your support team. Make sure your support people know what helps you relax. Do you want quiet encouragement, or do you prefer silence during contractions? Do you like being touched and massaged, or do you prefer not to be touched when you're in pain? Communicate these preferences ahead of time. Pack strategically. Pack your hospital bag by 36 weeks. Include comfortable clothes, toiletries, phone charger, snacks, and anything that brings you comfort. Don't forget items for your partner and your baby's going home outfit. Consider a childbirth class. Taking a comprehensive childbirth class, whether in person or online, can dramatically increase your confidence. You'll learn not just breathing techniques, but also comfort measures, medical interventions, and what to expect postpartum. You've got this. Your body was designed to do this incredible thing, and with preparation, support, and these breathing techniques, you're setting yourself up for the best possible experience. Remember, there's no perfect way to give birth. Some labors are quick, some are long. Some people use all the pain management available, others use none. What matters is that you and your baby are healthy and safe. These breathing techniques are tools in your toolkit, not rules you must follow perfectly. I'll be creating follow-up videos on postpartum recovery, newborn care basics, and partner support during labor, so make sure you're subscribed. Drop any questions in the comments below. I read every single one, and your questions often inspire future videos. If you found this helpful, give it a thumbs up and share it with any expectant parents in your life. Thanks so much for watching, and I'll see you in the next video. You're going to be an amazing parent.